welcome to our webinar hosted by the American Public Human Services Association, also known as APHSA, in partnership with VMO. Today's webinar topic is strengthening integrity in child care subsidy programs, addressing fraud risk through design, not disruption. Next slide, please. So my name is Francesca Robinson. I'm an instructional designer with APHSA, and I'd love to just take a few moments to share a little bit about who we are and the work we're proud to do alongside of our members. So at APHSA, we represent human services agencies at the state, county, and city levels from across the country. We're a bipartisan organization dedicated to building common ground and generating practical solutions that work for people and communities. Next slide, please. So we aim to advance the well-being of individuals, families, and communities through three core channels. So those would be influencing modern approaches to sound policy, building the capacity of public agencies, and then also connecting leaders to accelerate learning and generate practical solutions. Our vision is really one of thriving communities built on human potential. And then next slide, please. So lastly, while we're on the topic of staying connected, I just want to let everyone know about the APHSA conferences that we're hosting in 2026. And those are going to be in Arlington, Virginia, New Orleans, Louisiana, Spokane, Washington, and Salt Lake City, Utah. You can find out more about these conferences at the events page at aphsa.org throughout the year to learn more about how to register, keynote speakers, different session topics, things like that. And then next slide. And then the other thing I wanted to mention is that APHSA also offers a career center. So it's a dedicated job board and talent marketplace designed specifically to connect professionals with career opportunities across the human services sector. So this really serves as a valuable resource for individuals seeking new roles, advancing their careers, or just exploring opportunities within the sector. Before I turn it over, just a few housekeeping items for this webinar in specific. As you probably have seen, it's being recorded, so you'll all get the recording afterwards. And then also during the webinar, if you want to have all your questions go into the Q&A panel, the regular chat is disabled, so the questions and answers panel is the only way that you'll be able to communicate with the panelists. I think that was it. So now it's my pleasure to turn it over to our moderator, Heather.
Thank you, Francesca, and thank you all for being here. As Francesca just said, my name is Heather. I'm Heather Korbulik, and I'm the Vice President of Policy and Communications with VMO. Before I had this job, I was in the company of you all, which is spending 15 years working for the state of Nevada in a variety of different human service leadership roles, which makes me very excited to be here today and get to communicate with all of you. Today's session is about transformation with really a simple but a powerful premise. That's business drives technology and not the other way around. And as agencies like yours work to modernize services, there's often a temptation to start with the system. Wyoming, as you'll hear, took a different approach. They started with families, providers, staff, and the outcomes that they wanted to achieve. And the technology then came later as a tool to support their vision and to streamline processes and build the safeguards that are needed to protect program integrity and public resources. What you're going to hear today is the story of that journey, how Wyoming reimagined its childcare ecosystem, redesigned processes around their needs, and then leveraged technology to create a more efficient, accessible, and accountable experience. If you could go to the next slide. We are fortunate to be joined by two people who helped lead this work. Roxanne O'Connor is the Support Services Senior Administrator for the Wyoming Department of Family Services, where she oversees information technology, policy, human resources, staff development, and early care and education programs. She's been a driving force behind Wyoming's modernization efforts and the development of its integrated early childhood system. Also joining her is Carrie Gray, a consultant and a functional lead with VMO's childcare practice, and a childcare leader with more than 30 years of experience spanning program operations, policy, and system modernization. Carrie partners with states to redesign business processes and implement solutions that improve access and outcomes for families and providers. So please join me in welcoming Roxanne and Carrie, and I'll hand the microphone to you, Roxanne.
Great. Thanks so much, Heather. Thank you, everyone. I appreciate so much this opportunity from APSA and from BMO to be able to highlight the incredible partnerships that we have and just some of the really amazing work that Wyoming has done to really impact families and really make a difference in our communities. So with that, next slide, please. Like Heather mentioned, we're really going to talk about the journey of modernization. And what you're going to hear from me from a business perspective is really a focus on creating a strategic vision, creating values that tie to that vision, ensuring that transformation and a human-centered approach is really at the focal point of any sort of modernization effort, and that ultimately it is the business, it is the buy-in from staff, from communities, from providers who are leading these projects to ensure that it really meets their needs at the end of the day. And then after we talk about that, we will go into really how we approached the actual system modernization. You'll hear that from Carrie. And that will go into some more logistics and some more practical applications, but really it will all center around how were we brought to the table, how did we have conversations, really thoughtful conversations, how were the voices of providers, of constituents and communities integrated into every decision that we made in order to have a really pretty awesome outcome, which was a super efficient system that we've been able to put in place and we've been able to adapt to meet the needs of providers and communities and businesses. Next slide, please. So as some of my colleagues say, it's better to be lucky than good. And so as it turns out, as we were going about this and really started to think about what were our core values as a human service agency and what were the strategies behind those core values, it turns out AFSA was having very similar conversations. And so we have the AFSA core values here on the slide. And the reason that that is important is because these core values actually came to our attention after much of the work that you're going to be hearing about was completed. But in these core values, AFSA went ahead and they released a playbook in May of this year that really highlighted significant areas for early care and education. And so the two values that we see from AFSA that tie back to early care and education, you can see that there's an emphasis on access to affordable and quality care, that there is an emphasis on financing and what that means for providers and what that means for families. And you can see that there's an emphasis on building integrated systems that not only encapsulate all of early care and education, but as you'll hear throughout this journey, really connects to many other programs as well, especially in the child welfare sphere. So we wanted to highlight that even though these core values came after a lot of our modernization efforts, what incredible validation that we are on a good path and that the values that we have here in Wyoming really do resonate at a national level. So we so appreciate the focus that AFSA has put on the early care and education sphere in helping us to move this initiative forward. Next slide, please. So at Department of Family Services, our work is centered around three core values. And you can see those core values here. They are safe at home, opportunities for success, and supporting the people who support the families. When we look at early care and education and we see how they fit into our core values as an agency, we can clearly see that early care and education, especially from a child care assistance or subsidy standpoint, really falls in line with all three of these values. When we look at safe at home, we know that families who receive child care assistance are more likely to be able to go to work and provide for their families, knowing that there's a safe place for their child to be nurtured and loved and cared for while they are in the workforce. That is then going to set them on a trajectory to be able to be self-sufficient and be able to provide the supports that they need for their families. When we look at early care and education in regards to opportunities for success, what we also know about early care and education and what research shows us is that ECE programs are a great connector for families. It's where families start to create bonds, where they can share experiences, where they can ask questions, and they can really start to have a community that envelops around them to be able to be that support that they need while their child is in care and even outside of care. So it really is a great connecting opportunity that we want to make sure families have. And then supporting the people who support the families, that's really where we see our provider community come in. You'll hear as we went through this journey of modernization and transformation that providers' voice was at the forefront of these conversations, that we heard from families, we heard from staff members, and those voices rang true throughout the whole project. And we believe that we really were able to reflect what we heard in the system that we were able to develop. Next slide, please. So as many of you know, I'm sure, there is a strong connection between early care and education as a primary prevention tool to child welfare issues. And so we really focused on that and how child care assistance or access to early care and education in general can be a great preventer of child welfare incidents. Research shows us that about 15% of maltreatment issues can be avoided or prevented if child care is available to families, especially a mother. And so when we started to look at early care and education and really started to look at it in a bigger way, we made sure that it was really well understood that child care and early care and education is really a community service. And that what that means is that if that community service is thriving, if it's efficient, if it's accessible, then what we see in regards to these other services, there's just less demand for them. There's less need for them. There's less court-ordered placements because we're able to connect those services at a very local and at a very community level to then avoid any further interventions within the Human Services Agency. Next slide, please. So while we were looking at early care and education, and really it started to come to light that this was so much bigger than just providers or just families who were receiving solely child care assistance, but really started to look at it through the prevention-oriented lens. At the same time, we created a 3-year strategic plan within our Human Services Agency that focused on increasing access to concrete supports, so child care assistance being an example of that, for the very reason that I just said, we see it as a primary prevention tool, and then being able to really make sure that the supports are in place to be able to grow those supports for families was really important for us and is one of our primary goals here as an agency. And in addition to that, we also recognize the need that we were going to have to modernize a lot of our legacy systems. Many of our systems were 40 years old or older, and so they were very manually intensive. They required a lot of internal knowledge to be able to make determinations or figure out workarounds between the systems. And there was no connection between systems that function for one program versus systems that function for another program. So we recognize and we continue to recognize the importance of IT and a modern system when it comes to making sure that we are connecting families to these concrete supports. Next slide, please. You're going to hear a lot about planning and strategic planning. So in addition to our overall agency strategic plan, we also identified the need to have a centralized IT strategic plan. And a little bit of context here, this came at the time where COVID was new and scary, and also we were receiving funding for a lot of modernization efforts as well. And so when this was all happening, and as many of you can relate, happening very quickly, we knew that we had to make some decisions about the opportunities that we had, and that we needed to make these decisions collectively across our whole department and not within individual divisions or in silos. And so at the point where we had to stand up some programs very quickly in order to provide assistance to communities, we made a decision that we were going to create a centralized IT strategic plan that centered around the premise of having a unified platform. And so that was a decision that was made about 5 or 6 years ago. We now have a unified platform that we have all agreed that we need to use, that data needs to come into, it needs to be accessible, and most importantly, it needs to be able to be cross-referenced and connected across programs so that we then can start to approach our work and look at our families in more of a holistic way, instead of having families come to us for one specific need, serving that need, and then potentially not serving all of the other needs because we don't know about them, and our families may not know to ask the questions, right? So this is a way for us to make sure that we are really organized and mindful around the programs that we have, the information that we have, and ensure that we're able to make really strong connections between the programs and the opportunities that we have in order to make sure that families are supported through all of the needs that they have when they come to us. Thank you. In addition to the planning and in addition to the strategizing, all of this was occurring. And then, like I mentioned, this was really during the time where COVID was hot and heavy. And as many of you can relate, this is really when we started to see strong advocacy and the business community come to us and say, hey, did you know that early care and education is really important? Did you know that businesses can't stay open because there's a lack of childcare? And so we had always been really focusing on ECE from a prevention standpoint and from a human services standpoint. And then it started to really mold and shape into more of a community service as we brought business leaders together from our business alliance, from the business council, from the small business development centers to say, hey, this is a really important topic for all of our communities and for our businesses. And we want to be a part of the conversation about how we can help solve the childcare access issue. Through partnership with the Wyoming Business Council, we were able to contract with the Harvard Growth Lab, and they were able to identify a workforce constraint of about 10,000 individuals in Wyoming who weren't able to join the workforce because of childcare constraints. For context, we have about 275,000 individuals who are in the workforce right now in Wyoming. We are a very small state. And so 10,000 is a significant amount when we're looking at trying to make sure that we have a strong workforce and we have some bench strength there. And seeing childcare as a constraint to that really helped to bring businesses into this conversation. We welcomed that conversation, of course, and then brought in many of our partners who really focus on quality to ensure that as we look at how we can help to grow ECE in Wyoming, we wanted to make sure that that was done in a supportive way and in a quality way. And so we brought together our professional learning collaborative. We brought together behavioral consultants to make sure that all of the supports are in place as we start to really identify areas where ECE could grow and be beneficial in Wyoming. And then also in the maternal child health area, so really the population health area, there are new domains that focus on parental support. And one of those is access to childcare. So we're starting to see ECE and childcare become a conversation in many different areas. And what we have done is we have brought together and really started to do some coalition building around ECE to see what areas we can focus on and really make an impact so that communities can have access to really quality ECE, that providers can feel supported in their businesses and in their business structure. That's where the Business Council comes into play. And that ultimately children and families have access to really quality care. Next slide, please. So through this coalition, we identified 4 strike teams. We call them strike teams. I think that's a great word to call them. And we really focused on how can we help to infuse funding into providers and help them get started with meeting rules, with just developing their infrastructure so that they could make a go at providing ECE within their communities. We also focused on connecting them to business supports. We focused on connecting them to each other to be able to provide supports to each other. And then we also focused on local zoning and regulatory improvements. An example of that is we took on really kind of a common sense approach to our licensing rules to make sure that there was a really strong balance between child safety and ensuring that providers were really set up for success, not only when they were starting up a child care program, but all along the way, so that the administrative burdens were not the area of focus, but caring for children were the area of focus. And then the one strategy that I really want to narrow in on is number 2 on this slide. And that's where we see an increased access to subsidies for the child care workforce. That's where you're going to start to hear about the system that we put in place. It's called ECARES. And we know that this is an area that we want to focus on, but we wanted to wait to do that until we had modernized our system. And the reason for that is because prior to ECARES, which launched in August of last year, we were using triplicate forms to be able to track attendance, to submit invoices. And so we knew that we had to do some modernization. We had to create some efficiencies within our programs before we were going to promote this program to the child care workforce. But we also know that this is a need for the child care workforce, that they are operating on razor-thin budgets, that staff aren't able to be paid that much, and that this could be an area where we could really come in and help to support the child care workforce in a targeted way so that they can then better support families and communities. Next slide, please. Thank you. So if you were to ask me, did you always think about early care and education in such a global way and in such a transformative way? I would be the first one to say, no, I did not. And there's a few different reasons for that. One is that within just our department, we have childcare spread across a couple of different divisions. And so we have a division that houses childcare licensing. We have a division that really focuses on eligibility for a number of programs, including childcare assistance. And so as we were looking at modernizing, we initially started out with just modernizing our childcare licensing system. So we were going to make sure that it was more accessible, that families could be able to go and do the research that they wanted to for childcare providers, and really get connected in that way. We were going to make sure that credentialing for childcare providers was user-friendly and easily, and training could be tracked. So that was our initial vision, was we were going to focus on licensing and really modernizing that and making sure that it was user-friendly for our staff, that it was efficient for providers, and that we really had a solid handle on that. And then we heard from the provider community. And what we heard from them, as you can see, was a plea to create efficiencies within the child care assistance realm. They wanted to see payments get to them more quickly. They wanted to get rid of triplicate forms. I just couldn't believe it, but they did. And they wanted to make sure that we were really focusing on that area because it is a place where we could invest in early care and education. It's a place where many of the providers rely on that as a funding source. Many of the families rely on that to be able to have access to care. And so when we asked providers really where our focus should be, this is what we heard from them. They wanted to see weekly payments, more timely payments. They wanted to see it be easier to track attendance and get that selected. They wanted to be able to make connections with families. And so we said, okay, well, we better take a serious look at these comments and really think about where we need to focus in regards to our modernization effort for early care and education. Next slide, please. In addition to our provider survey, I had somebody walk into my office with this beautiful depiction of what a childcare ecosystem should look like. And so one of my colleagues, this is just our joke. We have this framed now, but ECARES really did start as a back of a napkin idea, where we started to rethink about the way that we were looking at early care and education and started to realize that early care and education is for everybody. It's a community service, regardless of income, regardless of where you live, regardless of your need. Early care and education is for everybody. And we saw this happening all along the way, right? Child welfare started to come into play. And then the business community started to have a voice. And we thought, gosh, this really is a place where anybody who is looking for early care and education resources needs to be able to come here, and they need to be able to find what they are looking for. And so this, again, we joke about this picture, but this really is the thought process and the vision between how do we make connections between a very regulatory function, which is our child care licensing area, connections between education, so our resource and referral area, and connections between child care assistance. And so ultimately, the vision was that somebody can come in, whomever it was, look for child care. They could connect with the provider. They could see then how much that care might cost. And then they could go ahead and see if they qualify for child care assistance all at the same time. And so at the end of their experience, and we really focused on the experience, they would be able to know that they've connected with a provider, whether enrollment is an option, and whether or not they might be able to have some financial support to be able to help them with their early care and education expenses. And so ultimately, that was the vision that we had, was anybody can come in, they can find childcare, they can connect with providers, and if applicable, they can know that they qualify for assistance in one interaction with our system. And so with that, we've gone from strategy and values, community engagement, to really focusing on the vision for a system. And I'm going to hand it to Carrie to now highlight the great work that we did there.
Thank you, Roxanne. Hello, everyone. Glad that you're with us today. So over 3 years ago, we were approached and given the opportunity to come alongside Wyoming and the DFS team to help them achieve the strategic plans that they had outlined, all of the vision that they had been strategically envisioning and wanting to put in place to help support the families and communities, as Roxanne had explained. So getting to the process where they were ready now to bring in a partner to help them embody this vision and create this system that would help support all of their visions and all of their goals, strategic goals for the division. So we decided what's the best way is to do a one unified platform that includes 3 stakeholders and endless impact to families and communities. So this became the birth of ECARES that Roxanne referenced, which is known as the first VMO Childcare Exchange. and it was built on a modular integrated architecture that seamlessly it can exist with other state systems. It can also deliver unified experience end to end. And then the three stakeholders who matter most, the agencies, the families, and the providers, are able to be connected into one ecosystem. So as far as agency supports, we know that the states have oversight and need to gain robust administrative tools to fully be visible into the child care ecosystem. So less manual work was going to be required. Stronger compliance oversight was a big topic that we had discussed, and more effective program management at a scale. So looking at those program processes, procedures, rules, and things that were being implemented in both licensure and eligibility. With the data controls needed to maintain program integrity, the agency is able to do that and have the data that they need to make sure that those things are being maintained with program integrity. As the families came on, eligibility determinations are happening in real time and can easily transition into shopping for a electronic, intuitive, and frictionless enrollment into a high-quality provider in the state of Wyoming, which is getting families to care faster with significantly less barriers, which at the end of the day is the ultimate goal. And then for our providers, the providers in Wyoming, certification is being completely done in the platform, the One Solution platform, allowing providers to list services immediately upon approval. They have a greater system visibility, means more families can discover and connect with them. And it is expanding the reach and equalizing opportunities for the different provider types in the state without additional marketing efforts or costs being spent for those marketing efforts to make sure that they are receiving that support and being able to be visible to families in need of childcare. So the bottom line for the one unified platform and the three stakeholders was the endless impact that the modular design allowed Wyoming to adopt that fit their specific business needs while meeting all program integrity requirements. When agencies and families providers are all well served within one Connect system, we see great success stories and we see great outcomes. The entire child care system becomes more effective, a lot more equitable, and more accountable for those program integrity pieces. Next slide. So what was the ECARES vision? So once the strategic plan was defined for the IT, for the DFS system, for the agency, then we had to come in and say, okay, how are we going to implement a technology system and create a one-stop solution? And so the core philosophy for ECARES started from a simple premise that every family looking for childcare needs childcare 100%, no matter whether they're receiving subsidies or not. So this platform is not built for a subset of population. It's built for a universal reach, and whether families need financial system or not, they are able to access the childcare needs that they have within the state of Wyoming. Traditional eligibility requirements serve as an important purpose, but we can sometimes, as an agency, unintentionally exclude families who are just over maybe income thresholds, lack being able to supply certain documentation, or work outside traditional hours. So these families need support just as much as anyone else. And so ECARES centers needs along eligibility lines and ensures more families have a path to quality childcare regardless of where they fall in the ecosystem. And then the 4 modules that we have instituted into the one connected system is built for a full life cycle of childcare administration. So when we look at the first module, it's the parent provider portals. It's intuitive, front-facing, accessible for families and providers, and extremely user-friendly. We have the workforce credentialing piece in the system that allows to what Roxanne spoke to earlier for the childcare workforce, right? We know that there are childcare capacity issues. We know that there are staff issues within the childcare ecosystem. And so we have allowed for the system to be able to provide quality assurance and compliance management for workforce credentialing. We also have implemented the module for attendance and payments, which streamlined some optional operational processes and building integrity controls. And we'll talk about that more in depth in a few minutes. And then, of course, the biggest piece that a lot of the childcare ecosystem is missing as a whole is robust reporting and analytics. So we always need, or we can utilize real-time data that empowers agencies to manage, monitor, and improve program performance and integrity. And so how does that reporting and analytics used to provide that data to ensure that things are being monitored and that improving in performance for the services that are being provided? So the results of these 4 modules is one ecosystem, which is a fully connected childcare infrastructure that we know can be designed to serve every stakeholder. So we're talking stakeholders from families that need childcare assistance, families that just need assistance with finding the right quality childcare that meets their family's needs, providers, and then, of course, the agencies and stakeholders. And this is all done within one single cohesive platform that is now ECARES. Okay, next slide. So Roxanne and I talked about, and Heather talked about initially, about the way of thinking around business drives technology, not the other way around. When we first approached this project with Wyoming, we had to talk about what are the processes in place, what are the procedures in place, what are the eligibility requirements, are there any barriers that we see? So we did what we call business process redesign with the Wyoming team, and we came to some conclusions about policies. We came to some conclusions about processes. We knocked out some policies. We redefined some policies. We determined that there were processes that were not necessary. One example I can give you is Roxanne was talking about the triplicate applications. Well, the triplicate applications were happening, but they were also required to do in-person interviews, not knowing that federally that was not a requirement, that they did not have to do in-person interviews. So knocking that out to where we could do an online application and then not have to wait to have an interview or for time to allow for a family to miss work, right, to go for an interview. So just redefining and looking at your policies and procedures and processes was a huge point in building the system. So we know that too many technology implementations fail for that one of those reasons, right? That the technology dictates how the business operates instead of the other way around. So as we were strategically planning on how to build the software, we ended up asking questions like, what is the best hierarchy, right, for this? So it's business first, then how the business applies the policies that are required, and then how that policy then feeds into building the technologies to support the system, right, and the business. So the workflow and configuration decisions should start with one question, and as we know, and what does the business need to accomplish? So again, you're looking at the business and their accomplishments, their goals, and their vision. And then that policy translates those goals into rules and requirements. So then after that, technology enters the picture, and the tool built to execute those decisions, it provides a structural guardrail against fraud, waste, and abuse. And it also allows for seamless access for families and providers. Why does it matter when business drives technology? Because the system adapts to how each state operates. So the ECARES system is adapting to how the business at DFS Wyoming works. It's flexible enough to meet program integrity, serve communities effectively, and collect data, but it also needs to evaluate and refine policy over time. As we know, policy changes can come at any time, and we have to be flexible in that time when those do come. And so how do you create a system that when you need to evaluate and refine policy or change policy, how does that system lock you or limit you into making those systematic changes because of the policy-driven changes? So the risk of getting backwards in technology comes before business and before process, is that we can sometimes get the response, we can't do that, the system doesn't support it. I know many of us states have heard that many, many, many times, right? That the system just does not support that. But the better question, I think, as we go through a modernization is, how does the system support what you need to better serve your communities and meet your visions and goals? And I think that's the question that we all started out with at the Wyoming Project. And that's how we came to such a infrastructure that is supportive of the business and also of the policy, not the other way around. Okay, next slide. So ECARES was born, as Roxanne said, in August of 2025. Just sharing some statistics here with you on electronic enrollment. So we went from that triplicate paper to having, this was their first 90 days of ECARES. So these statistics you see here are for the first 90 days. We have over 2,500 enrollments for over 1,200 kids right at this point, almost a year into ECARES. The average payment processing is still 6 days, where previously it was 15 days average because it was done through paper manual processes. So we've been able to cut that down to 6 days. And then over 2,500 payments have been made through ECARES since August of 2025. And then with the applications being submitted, they've received almost 2,800 applications up to date since the inception of ECARES in August. So as you can see, there's some great statistics behind how one integrated solution is benefiting not only families, it's also benefiting providers, it's also benefiting the agency by getting things out quicker and being able to supply those services for families quicker and for being able to provide those funds for providers, right, to make sure that they're sustaining their high quality programs and able to hire the high quality staff that they need. So them receiving those payments quicker is a huge asset for providers. If you remember on Roxanne's slide, it talked about providers really wanted more work to be done on the eligibility side, right? And one of the big things that they talked about was payments. And so being able to knock that down to them to where it's an electronic process, electronic validation, and those processes being done in 6 days. So here we are now, ready to launch phase 2 of ECARES in August of this year, so in the next coming months. And this is going to be built on the foundation that expands on the capabilities for provider side. So phase 1 was really heavy in regards to eligibility determination, compliance, and provider payments and provider search and provider enrollment. And so phase 2 is going to be more about providers gaining they will have a dedicated entry point to manage their enrollments, their licensing applications, their payments, expanding their professional development offers, for options for their staff and their personnel. And then also introduces strategic goal measurements and continuous quality improvement tools. So that means that's giving the state stronger infrastructure for oversight, compliance, and long-term program performance. So the big picture of an integrated system here with ECARES has been that everyone in ECARES has its role, and every role affects each other in that system. And so when each stakeholder is in the same system, it adds to the availability for families. It adds to quicker enrollments, it adds to quicker payments, it adds to quicker authorization for eligibility. And it also provides a integrative system that works because everyone is in it has a role, a purpose, and the stake in it is successful. Okay, next slide. So some of Wyoming's results. These were great results. So they had the triplicate paper application and they went to 99% digital applications. So we went really far with that in determining immediate eligibility. 23 steps, 15 touches. So when we were doing business process redesign with Wyoming, we mapped out their current process for eligibility determination. And it was taking 23 steps for a family to become eligible. And it was touched by 15 different people or 15 different processes, right? It was being touched by. When we implemented ECARES, we got it down to 3 steps and 1 touch. So that means that this is being not only processed faster, but the more people touch things, the more likely there is for human error. And we all are, all applicable to human error. We all have the ability to make a human error. So when you have less people touching it, it does deteriorate from any potential improper payments, ineligibility determinations, or eligibility determinations being wrong. So this was a big process for their integrity of the program and determining eligibility. The manual determination of eligibility and subsidy amounts. So as Roxanne referred, there was 3 different systems. They were determining these in, and then the paper application or the paper process to get subsidy amounts figured out. The calculation, again, introduced huge risk for human error. But the automated eligibility determination in ECARES has taken that human risk out and made a more substantial system that could be deemed as being more efficient, effective, and proactive. Verifications and entry in 3 different systems. Again, you allowing for a lot of human error, right? When you're having to work in 3 different systems, making sure you're entering the same information in all of those systems. The digital verifications and the ID verification was one big piece that we did implement that was strategic in this planning. Okay, next slide. Security, I'm just going to go over this high level. So child care subsidy fraud, we know, can be a minor administrative inconvenience, right? And it's viewed as systematic problem that could have real financial impacts and reputation consequences for agencies. So as we were looking at paying providers for services, we wanted to make sure that we were paying providers accurately, one, and that we were paying providers that were eligible to receive that federal funding. So we faced serious program integrity vulnerabilities. We knew that we had to make sure that everything was robust. And as you can see here, this is the different layers of security that is in the ECARES system. So the layered architecture, the encryption of PII, the hearted application components using secure coding principles, and then role-based access, right? So that no one is going to have access to the system that is not, one, supposed to have access to the system or is able to do what only they need to do in the system, whether it be a family, a provider, or the agency administration. Next slide. So as we were looking at the ECARES system as a whole and what we had implemented into one unified system, we talked about what we could do to do a case study on how we're combating fraud, abuse, and waste with the ECARES system. So one of the biggest pieces that we started out with was some key measures in preventing those inappropriate payments to providers. One of them was no enrollment is created, and no enrollment and no authorization is created unless a provider is either formally licensed by DFS or specifically documented as exempted, and has affirmingly acknowledged that they are eligible to receive subsidies. So no provider that was not regulated in some way, whether through licensure or exemption, was going to be able to receive authorizations or accept enrollments for authorization payment. We acknowledge that the requirements adds a second layer of accountability so that by requiring providers to affirmatively confirm they are receiving subsidies, ECARES ensures that no provider can later claim ignorance of the terms and obligations, right, that they didn't know, and that our awareness of the documentation and the responsibility of accepting those federal funds. And then thinking of this as a front door system for payments, it's locked until the right credentials are presented. So again, there is no way for a provider that is not eligible based on licensure or exemption or clearance from DFS that would be able to receive any enrollment request or authorizations for subsidy payments. So that was our first layer of control. The second layer of control was attendance verification. Of all the controls built in a system, I think this is arguably one of the most operationally significant. I think it deals directly with addressing the core fraud pattern that we see sometimes in child care programs, billing for children who were never there, billing for children that have never enrolled, children that were absent, but they were claimed as attending. And so therefore, we wanted to make a system that is triggered by enrollment, right? Which we know the feds are moving towards. So payment by enrollment. When a child was enrolled into a program electronically, that payment goes out, and whether care was actually delivered is left to manual process in most times. And after the fact, then audits can catch the problem after the fact, not in real time. Well, ECARES was configured to fundamentally invert that model. So what we would designed was payments do not flow until attendance is verified with no exceptions. So families have the opportunity, or providers have the controls to be able to submit attendance accurately. And the way they do this is they have to log into the system and verify each child's attendance before the payment cycle runs. And what this is doing is populating a child care attendance record based on what the family has identified their child care hours of care to need to be. So this is not populated by the provider itself. It is populated by what the parent provided to say that this is the hours and days that they need care for. And the provider does validate those times and days on the attendance sheet and submits that for payment. And then once the payment has been received, then we display that information back to the parent and the provider in the ECARES system to show what exactly was paid for, which child was paid for, the amount, and the time frame that it was being paid for. This also gives transparency to payments on the parent side, not just the provider side. We also did require that that we did also implement a provision that families can dispute a payment. So they do see these payments being made to providers on their behalf, and they are able to dispute that payment if they do not agree with what the provider was given in regards to their attendance. And they do see do have the ability to see the attendance sheets as well to know what parents or providers had submitted for their attendance. Per agency perspective, this creates a complete real-time audit trail. It requires no formal manual file pulls, audits, cross-referencing between different systems, anything that falls outside of a normal system, manual processes, and it can also be a trigger to flag investigative cases quickly before they compound into larger issues, right? So the sooner you can catch the issue or the error or mistake, the less you can say bleeding that will happen, and so that way you can be more proactive in that investigation. And then the system does not wait for annual audits, right? You can pull the data, and it's accessible to the agency at any time, and they can be accountable at any point to be able to pull that data and see if there are any issues for concern of any fraudulent payments, overpayments, underpayments, and not have to wait for annual audits. The parental dispute payment, I already went over. And then the last piece is that eligibility is not just an administrative function. It's the fine line and the entry, right, to what could be abuse, waste, and fraud in child care subsidy. When eligibility determinations are accurate, we know that the systematically enforced consistency of those eligibility determinations is more respective to the program and applies more program tech integrity. So the right families receive the right support. When they are not, the consequences compound quickly, right? We see improper enrollments created, pathways for fraudulent billing, very scrutiny of no touch eligibility. So the less touches, the more opportunity is for correct determination. And then next slide, sorry. Lessons and key takeaways. So at a core, I'm just going to go over this really quickly. At its core, every control we know exists for one reason: to ensure that every dollar allocated for the child care assistance actually reaches who it needs to reach and supports who it needs to support. We know that ECARES just doesn't process payments more effectively. It processes payments and eligibility more honestly and proficiently. And in the business of administrating public funds, that distinction is very vital in what separates a good technology solution from a truly responsible one. And just to kind of real quick, I know we have some conversations, but I just want to say that what you've seen today is that Wyoming provides a model that works. A 60% reduction payment process time, a 23-step reduction to 3, all of the statistic that you saw, it just brings this business ecosystem to a full circle, right? And so the business case is straightforward. It's every dollar prevented from being improperly paid is a dollar redirected to a family who genuinely needs that support. So more importantly, integrity does not is not supposed to limit our families to access or our providers to access. It's what makes expanding access suitable and defensible to the legislators and oversight into the integrity of the programs. With that, I will hand it back over to Heather.
Awesome. Great job, Carrie and Roxanne. Thank you guys so much. We do have 4 questions that I think are interesting. So first one, I think maybe should be for you, Roxanne. Have there been any changes in the number of cases of fraud?
Yeah, thanks, Heather, and thanks for the question. That's a really good question, and one that obviously we are pretty intentional about keeping track of and looking for right now. We're fairly new into the system, but as of right now, we have not seen additional reports or cases of fraud up to this point. It's something that we continue to look at, but historically, child care assistance in Wyoming has had a very low fraud rate in general, and we haven't seen a shift or a change with that with ECARES.
Great. So the next question is, are real-time determinations available to all without independent income verification, or only those that are also served by another state program that has already verified the income?
Thanks, Heather. So the no-touch eligibility is based off of our current healthcare exchange that VMO has in several states around the United States, and we have successfully achieved 86% no-touch eligibility with the healthcare exchange using other APIs to other connections for other information. So it does not mean that a family has to be on any other services. It's just being able to tap into other agencies or other forms of information gathering that we can provide and use that for the family's eligibility determination. So with our healthcare exchange, we're trying to build upon that in the child care exchange and get that to at least that 85 to 100% no-touch eligibility through not requiring additional documentation.
Great. The next question is, how do you handle pre-populating attendance for clients that have varied schedules from week to week?
So attendance schedules, so we have in the ECARES system, a family is part of their application. Once they're approved, they will submit the parent schedule, and then they will also submit the child schedule. And so the parent schedule is done monthly. They can do it a month at a time. They can do it weekly. They can do it for the full 12-month period. It's totally up to the family. It's accessible to them at all times. So anytime they do have a shift in attendance or a shift in a work schedule, all they have to do is go in and update their work schedule or their child's attendance schedule, and that will populate over to the provider attendance sheet for accurate determination or accurate payment reconciliation.
So the next one is, were there other systems licensing, or for instance, licensing childcare searches, et cetera, held in online systems, or were they paper as well, like the assistance portion?
So as Carrie mentioned, phase 2 of ECARES, which launches this August, is really our licensing and our credentialing system. And it was a hybrid of both. So when we look at the application or the renewal for licensure, that currently right now today is still paper. That won't be paper come August of this year. There are some things like training credits, mainly training credits that are electronic right now, and are with the combination of our learning management system that will also be in ECARES, and the credential tracking, the applications, background checks, all of those things will go electronic. The one thing that won't be electronic, which I think many of you can probably empathize with, is that we will still have to roll fingerprints on actual paper cards, and then we'll match the electronic file with the actual paper card.
Great.
And Heather, real quick, sorry, I just wanted to add a clarification. In regards to the HICS 85% verification, right, no-touch eligibility, you don't have to be involved with HICS. We just want to tap into those same resources that we do with our healthcare exchange, right, and that we just want to utilize those same resources and tap into that with our childcare exchange as well.
Thanks. Next question. So thrilled to learn about this work today. How do you support documentation of informal care like childcare through family, friends, or neighbor care providers or license exempt care providers?
Yeah, so we accommodate as in phase two, as Roxanne was referring to, it's going to be licensure, but it also will include our the exempt providers that are being serving families in Wyoming, whether it be relative, family, friend, or neighbor. We will be providing the same processes for them in the ECARES system for that and have the same access. So we want to make sure that access is on an equal level playing field for all different types of providers approved and eligible in the state of Wyoming.
Great. Next question. What did it take to get families to move on to or into this electronic system? What were the challenges?
We did a data migration from the existing system that Wyoming was using. So we did the data migration. We held several trainings virtually for families and providers to support. Then we created multiple videos, reference materials, supports, direct hotline numbers for supports, the DF to support. And so it was a learning curve, yes. But I would say, Roxanne, and I'll let you speak to this, the transition was pretty seamless. We did have some user issues, right, with some single sign-on issues. But for the most part, it's so user-friendly and family-friendly that there was not a lot of gap in the learning capability for use.
Yeah, and thanks, Carrie. The other thing that I would add there is we did have another partner with us who really focused on organizational change management. And so the communication piece with families and providers was key. We started communicating early. We started communicating often. We communicated the same message over and over again. We became accessible through trainings, through questions, like Carrie mentioned, through resources. To really make sure that it was well known what changes were happening, what needed to be done. We sent out individual letters giving those instructions, giving individual passcodes, just to make sure that everybody knew and was well informed in advance of the changes that were going to happen. And then, of course, afterwards, we had hotlines. We had a number of individuals available to help with any sort of technical assistance. But once everybody was able to get in, like Carrie mentioned, single sign-on is a lesson learned for us that I think we can apply into the future and will. But outside of that, once they're able to get in, it is pretty intuitive and user-friendly to be able to navigate.
And Roxanne, I would just add I think the implementation of office hours, virtual office hours was huge, right, for the transition. So we allocated 2 times a day for several weeks upon implementation where the VMO staff and the DFF staff combined forces to be on those calls to help support families and providers.
Next question, I think maybe Roxanne. I understand in-person interviews was removed from your practice. Do you interview the parent? And if so, how is the interview conducted?
Yeah. So when we talked about taking away the in-person interview, right, it's the goal is for the families to go in, submit their application, do as much no-touch eligibility behind the scenes as we can, and then allow them to do that document upload into the system, right? We have a case management system that then references and pulls that work over to the eligibility workers immediately for review. So once that documentation is uploaded into the ECARES system, the case management assigns that and it's looked at in the system. The only time that families are reached out to is if there's a question on some documentation they provided. Families have the ability to submit a support ticket in their ECARES portal. So if they have questions about how to do something or if they're eligible or what document is required, they just submit that ticket and then the eligibility worker reaches out to them immediately, again, through the case management system. So there is not necessarily per se interviews, but there is ability to contact families and talk to them if they have questions, comments, or concerns, or the eligibility needs more documentation.
Great. So we have 4 more questions. I know we're a little over time, but we are going to answer those so that that'll be included in the recording. And so the next question is the attendance reconciliation automated between what the parents report and what the provider reports prior to payout?
Yes. So what happens is again, the parent puts in their work schedule, then they put in the child's need for care schedule. Once that is put into the system and they are enrolled into an eligible provider, then that attendance sheets creates for that provider. Once the payment cycle ends, then the provider goes in and reviews, is required to review every single attendance sheet for every child they have enrolled receiving subsidies. And they review that sheet. They make any necessary changes based on attendance, and then they submit that individual attendance sheet for that family. Once that payment sheet is submitted, then we run payment. DFS distributes that payment, and then we send back and display the payments made based on child at the child level per provider, and then for the family level to see the payments made on behalf of their family.
Great. Can you share information on how eligibility determination went from 23 to 3 touch points?
Sure. So when we do business process redesign as part of this process for modernization and building technology, the key component is we go in and we do as is mapping, right? So we take the wall and we put up post-it notes and we do their current as is process. So we map it out to see what it looks like today. And we go through and we say, okay, this 23 touches means 23 things had to be done in this process, right, that you're doing. And that there was so many people, how many people touching it, right? So how many different individuals were touching it. So what we do is we take that as is process and we look at it and we decide where we can cut some touches, right? And so how do you have not 3 eligibilities working in the same case, for instance, the same application? You go in and you put one application in the system, you have a case management system that routes that application to a caseworker, and that caseworker finalizes that case, right? It's not a case load type system, but it does allow for less touches. So when a family has the ability to complete their application, be able to upload all verifications and documentation that they need, it does not require as many processes and as many touches in that process to determine eligibility. Therefore, it cuts out human error.
And Carrie, if I can add to that, you kind of already spoke about the APIs, right? Mm-hmm. So the APIs are the connections with data sources. So the work number, vital statistics, to be able to validate that information right away is one less thing that an eligibility specialist is having to focus on and having to validate themselves. It's done automatically for them.
That's a great addition. Okay, so are the schedules the parent enters for the child checked against their work schedules to verify the need, or do work schedules have to be from the employer?
No, so we do validate that. So eligibility, there's the eligibility determination is what is done by the parent schedule, right? So that's the maximum they would be eligible for. But the attendance is and authorization is issued at the child level for the need of care based on what the child needs.
Okay, I'm going to combine 2 questions here. Are there fraud risks that are not addressed through ECARES? And was segregation of duties considered when reducing to 3 touches? It sounds like it might allow for more fraud.
Yeah, I mean, we're always going to have a certain level of risk of fraud, right? But I do think that with the number of electronic means that we have in place to be able to validate information, with ensuring that providers and families are all seeing the same information, that families have the opportunity to very quickly identify when something doesn't seem right with their case. I think that those are all things that we didn't have before, right? And so I think that this has helped us to really be more in tune and have information that is validated, versus what we historically did was had post audits to be able to try and verify information, verify attendance, which is really difficult to do, because how do you audit and verify that a child was in attendance in the past? And so I think that this gets us closer to be able to do that in a much quicker and in a more real-time type way.
Great. Okay, last question. Have you been able to get formal feedback from families and childcare providers on how they like the system and what they like or dislike?
Yes, we have just launched our surveys, our feedback surveys. We haven't compiled the results and staffed them quite yet, but we have launched user surveys, provider surveys to see how things are going for them, because we know that with any new system that we need to just continually look at improving, right? And that's our goal. And so we know that providers really like the efficiency. They like that they are getting paid more quickly. Families like that they can get connected with their provider right away. And then there are some just user experience things that we're seeing and that we're hearing that we're really diving into to say, okay, how do we make this a little bit more user friendly? How do we make it clear that this is where you need to go and where you need to navigate? So we've heard some of those navigation tips and issues that we're currently working on to just make sure that the system is really what the families and the providers need it to be. So it's a mixed bag right now, as we would expect. And I think we'll just continue to work on those user interfaces to make sure that families are getting connected, providers are getting connected, and really the focus remains on serving the children.
Great. Okay, so we've reached the end of our questions. I think we have answered everybody and really appreciate everyone attending today. As Francesca and Marie said earlier, we will be sharing the recording of this presentation and the slides and encourage you all to reach out if you have any more questions. Thanks so much.